How many of you have children who scream and shout? How many of you have children who sometimes feel that their voice is a little hoarse, either sometimes or all the times? I'll be talking to you today about voice problems in children. I'm Dr. Shantanu Tandon, the Senior Consultant and Head of Department of ENT at Sakra World Hospital. Now, our vocal cords, which are responsible for creating voice, need to properly close when we speak. And for any reason, if these vocal cords are not closing properly, the voice quality will change. Now, constant overuse of the vocal cords, constant straining of the vocal cords when we talk a lot or when we shout a lot can cause small bumps and lumps to form over the vocal cords. They could be called polyps, they could be called nodules, or they could be just an irregular swelling. And although this is very common in adults, it is very commonly missed in children. It's attributed to kids are just like that, and it's one of those things which, if picked up early, can be halted, can be treated, and can be completely resolved. It's not easy to convince children not to scream and shout when they're playing football or shouting when they're playing with their friends, but making sure that they are gently told not to shout, and while modifying the diet, making sure that the hydration is taken care of, is the first step. Giving intermittent bits of voice rest, or even doing a small test called a laryngoscopy, where we actually look into the vocal cords and quantify and qualify the type of problems which the vocal cords are developing. The solutions, if picked up early, is voice rest, a little bit of exercises or speech therapy, and that's it. But these are the problems which, when they get worse, may require a small laser surgery or even something a little more complicated. So picking up on these problems early is important. Thank you.